Hi, I'm Shanaz Neely. I'm one of the clinical dietitians here at Bariatric and Metabolic Institute of Las Colinas. My role is to help you with lifestyle changes for weight management and get you ready for your bariatric surgery. After your initial visit with your surgeon, you will have an opportunity to visit with a registered dietitian. Depending on your specific case and your insurance requirements, you may require additional follow-ups with a dietitian. At your nutrition visits, we'll talk about weight management and we'll discuss topics such as how to read food labels, portion sizes, healthy grocery shopping, goal setting, and we'll answer any questions you may have. In addition to that, we'll talk about diet progression after surgery. This is to reintroduce food back to your GI tract to make sure you can tolerate your food. There are some dietary restrictions that you need to follow after your bariatric surgery, and that's why I want to make sure I will list those for you today. The first thing I wanted to talk to you about is eating slowly and chew your food really well. We want to make sure you chew your food so well that it kind of melts in your mouth, the consistency of applesauce before you swallow it. Also, take your time. Give yourself at least 30 to 45 minutes to finish your meals. This is going to really help with your food tolerance, and also it's going to help with absorption. This way you can actually enjoy your food. You can pay attention to the texture, you can pay attention to the flavor, and also it's going to help a lot with satiety. The next element we wanted to talk about is adequate hydration. We want to make sure for the first few days after your surgery, you drink at least 40 ounces of fluids. Later on, we really rather if you drink more like 80 to 100 ounces of fluids per day. This is going to help to make sure you won't get dehydrated. As a good rule of thumb, we recommend you drink 1 to 2 ounces of fluids every 15 minutes. So make sure you don't forget to drink. One of the main reasons that people come back to the hospital after bariatric surgery is for dehydration. So make sure you always sip on fluids. The third rule I wanted to talk to you about is the type of fluids I want you to drink. So I want to make sure you stay away from anything that is carbonated. Carbonation can actually expand the size of your pouch, and it kind of defeats the whole purpose of bariatric surgery. Also, it may cause stomach discomfort and bloating. So make sure you don't drink anything carbonated like soda. Also, stay away from any sugary beverages and anything that has caffeine. So for the most part, we want you to drink non-caloric, non-sugary, non-carbonated, and non-caffeinated products. The next key element to remember is not eating and drinking at the same time. This is not a problem before surgery. However, after your bariatric surgery, it's going to be very important to make sure you do not eat and drink at the same time. We usually recommend 30 minutes before and 30 minutes after your meal, you don't drink anything. Think about it. If you eat and drink at the same time, the fluid is going to push the food out of your pouch and you're going to end up with an empty pouch. That's going to make you feel hungry, and that's what you don't want to feel because you're going to overeat. Also, eating and drinking at the same time may lower your food tolerance. So make sure you don't eat and drink at the same time. That's very important. The next key element to remember is taking your multivitamin and minerals daily. This is vital. After you had your bariatric surgery, your digestion and your absorption is altered. Also, you can only eat very small amount of food. So it's going to be very important to make sure you take your multivitamin and your minerals daily. We will give you a specific regimen of the multivitamin and the minerals that you have to take. But we want to make sure you do it every day. This is for life. Failure to take your multivitamin and minerals can lead to major nutrient deficiency. For the first 6 months or so, we recommend that you take the chewable or liquid version. This is going to help with the tolerance and absorption. So remember to take your multivitamin and minerals every single day. Next key point to remember is eating balanced meals, including lean protein. For the first few months after your surgery, we put a lot of emphasis on eating protein. And that's because you are only able to eat 2 to 4 tablespoons of foods at each setting. So you want to make sure you get the protein first. However, over time, when the size of your pouch expands a little bit, our goal would be for you to eat more balanced meals. That means not only protein, but we want to make sure you include complex carbohydrates like whole grains, non-fat dairy products, and a lot of fruits and non-starchy vegetables. And remember not to eat a lot of sugar and fat. Not only they are very high in calorie, but your tolerance for these food items after surgery is going to be very low. So try to limit your intake of high fatty food as well as sweets, sugary beverages, and all those sort of foods. Last but not least is physical activity. We can't talk about weight management and not include physical activity. If you're not active at this time, I encourage you to start slowly. Do anything you like to do. If you like swimming, do that. You can dance, you can go for jogging. Anything matters as long as you try to do it consistently. Over time, you can increase the intensity and duration, and maybe you can participate in a structured exercise plan. But make sure you move every day. That's a big part of weight management. At the end, I just wanted to tell you, try to be positive. This is a long journey, and please give us a call. We are here to help and support you, and we're going to answer any questions you have. Look forward to seeing you in our clinic.